Hello everybody, this is Carlos and welcome to another video. In today's video, we're gonna go over how to care for a patient with a VAC dressing, or what we call a negative pressure wound treatment dressing. When we're caring for a patient with a VAC dressing, we're going to focus our maintenance and care as nurses on three main factors. Number one is going to be the patient assessment. Number two, we're going to focus on the wound site assessment. And number three will be the assessment of the actual VAC machine and setup itself. Now let's start with the first one, which is our patient assessment. Number one, let's make sure the patient's pain is well managed and well controlled. We're going to do our pain assessment and ensure that the patient is comfortable, provide any PRN analgesia if required by the patient, and ensuring that the comfort is achieved for patients who have VAC dressings. Number two, let's ensure that mobility is not hindered for the patients. We always try to encourage mobility in our patients within what is a safe parameters of the VAC dressing. Of course, we don't want the mobility to hinder the VAC treatment, but we also don't want our patient to be completely immobile. And number three, let's ensure that patients are well educated in when to call for help should the VAC dressing start to cause any troubles. And this is something that the nurse will educate the patient on the actual dressing itself, on any signs and symptoms that might be new to them or that they might feel unwell, and also if there's any alarms and beepings from the pump itself. Number two, now let's have a look at our wound site assessment. All right, for our wound site assessment, we're going to focus our assessment of the patient's dressing site, and we're going to focus on three main factors again. Number one, let's look at the actual dressing itself. As you can see from here, from this dummy that I have, do you see how nicely tucked in and sucked in is the negative pressure? This is how your VAC dressing should look like. They should look like they are sunken in into the patient, and this it's a very good seal that this dressing actually has. So we're looking at number two would be any of the exudates that is coming out, and you will see if there's any drainage from the patient from the wound. You will see in the tubing, and you're going to assess for our three letters: color, odor, consistency, and amount. And the amount will be done on the drainage canister that I'll show you later in the machine. And the last part will be to have a look at the skin around the VAC dressing. Make sure that the dressing around it is not reddened and it's actually not being broken down. The reason why is because the black foam, when it comes into contact with healthy skin, it can potentially cause more skin damage for that. So it's very important to assess the skin around the wound itself. And number three, let's have an assessment of our VAC machine itself, the tubing, and ensure that the orders in your health information system matches the settings of the VAC machine itself. And number three, we're going to have a look at our equipment itself, including our pump, our tubing, and we're going to ensure that our order matches the order in our health information system. In our organization, we use Epic Hyperspace, so I have entered a mock order for our wound example right here, and we just put it as a VAC pressure -75, low intensity, and to go continuous. So this is what you're going to see in Epic under the VAC dressings. How do we check that this is in there? Very simple. All you need to do is just go down to therapy settings, and it's already selected as a VAC because the VAC is already running, right? And as you can see, it is VAC dressing. The settings is for VAC. The pressure is -75 millimeters of mercury. It is low intensity and it is continuous. So perfect. That means that our orders from Epic matches our settings in our pump. Okay. Now the second thing I want to show you is this little button here that says seal check. When you press this, this is when the machine checks how much air is leaking out of the VAC. Usually you will see this little green indicator, and it fluctuates because the patient is very dynamic. You want this to be low and green. And as you can see like this, the machine is working fine itself. Sometimes when the indicator goes to yellow, meaning that there's a little bit more of an air leak, the VAC dressing might still work. However, once it gets to this little bar here, right, as you can see right here, and it constantly breaches over here, it's gonna turn red. That means that there's way too much air leaking out and the VAC dressing is not efficient enough. That's when you want to have a look at what is causing some of the air to be leaked out and not be able to create that vacuum within the VAC dressing. Next, let me show you how to change the canister. And the canisters, they always come in a single package, and there are different capacities from them. This one, the one I'm showing as an example, is 1/2 liter, and we do have canisters that's slightly bigger, and they do come in each individual canisters like this. They're closed loop system, meaning that you cannot drain anything out. Once the canister fills up, you have to change the whole thing. So how do we change if, for example, your canister is filling up to there? First and foremost, you have to stop the pump. Okay, so once the pump is actually stopped, the next thing we have to do is you have to make sure that we clamp some of the tubing here. As you can see, I'm just gonna clamp one of the parts here. And the team that you wanna clamp is the one closest to the patient. Let me just zoom out a bit, sorry. All right, now as you can see, this one, right? This clamp is closest to the patient, so I'm gonna clamp this one. And I'm gonna clamp the other one as well from the canister. And all you need to do at this point is detach, and it's a lure lock style, so you're gonna twist until the little thing goes up and detach, right? And then this part over here, team, how do you eject this? Very simple. Press this button, and the whole canister comes up. Okay? Now, let's say that you have to put a brand new one back in. Very, very simple. All you need to do is you're going to just attach this part. So let me show you. Put it on and just push it in, and it stays on. Okay? Next, all we need to do is just reattach the brand new one, and you're gonna match this into it, but please don't forget to lock it, okay, so it doesn't detach. Once that part is done, let's open up the brand new one in there as well. And all you really need to do is just press start here. The machine is gonna do a test now. This is a perfect time to show you an example of how an air leak looks like. Do you see that the machine right now is struggling a bit? Earlier, we saw that it was mostly green. Now it's struggling because then it's actually getting a bit of yellow. Why? It's because right here on my patient, this part over here is leaking out the air. So how do we fix this part in there? Very, very simple. If your organization allows, and our organization allows for it, you can grab a Tegaderm, okay? Or you can grab some of the VAC film that comes with it. And again, watch, we haven't done anything and the machine is working extra hard, right? So let's just put a dressing on just to extend it. Do you hear that it completely, the seal almost went away? And now we have a nice seal down there. Hey, and have a look at this. It's back to normal. And that's how you troubleshoot if there's an air leak around your VAC dressings in there. And that would be the most foundation and basic care for patients who have VAC dressings. And this video is intended for nurses who do not see a lot of VAC dressings in their unit, but you're still able to care and monitor for patients with the VAC dressings themselves. Thank you for watching and see you next video.